This 2024, we've had a number of Nigerians who have died in the United Kingdom. Suddenly, young people who have died. And that's why I'm making this video, because the leading cause or leading causes of sudden death in young people are cardiac causes, which means they're heart related. And I want to mention three that we need to be aware of. One is hypertrophic cardiomyopathy or hypertrophic obstructive cardiomyopathy. The second is congenital long QT syndrome. And the third is arithmogenic right ventricular dysplasia. I have a video, an animation video. If you check my channel, you see a very short video I made on arithmogenic right ventricular dysplasia. Now, when you see a young person who appears to be bubbly, appears to be vibrant and healthy, and all of a sudden you hear that that person died, either the person died in their sleep, or the person was standing or walking and suddenly slumped and died, or the person was exercising, probably cycling, playing football, playing basketball, and the person just slumped and died. You begin to wonder why. A lot of the time, that person has a congenital or an acquired heart problem that was not detected because the person was never symptomatic. The person never had any chest pain, any difficulty breathing, and the person was just apparently fine until that sudden tragic event happened. So what is hypertrophic cardiomyopathy? In simple terms, hypertrophic cardiomyopathy is a heart condition or a heart abnormality where the heart muscles, called the myotome, are excessively, the heart muscle, the myocardium, is excessively enlarged, excessively thickened. And usually when it's excessively thickened and it gets thickened around, what we call the aortic, the left ventricular outlet channel, close to the aorta, obviously that carries the blood out of the heart. When you have a lot of thickening there, then it can cause a narrowing or obstruction. And then when the person is exercising, usually when there's an exertion and the person is exercising or having sexual intercourse or anything that increases the heart's, demand on the heart to pump more blood, the heart might go into what we call arrhythmia. So irregular rhythm that might lead to a cardiac arrest, or that narrowed part of the heart might get, because it's very thick, it might contract and narrow even further and cut off blood supply out of the heart, and the person suffers from a stroke, or the person even suffers from a myocardial infarct, a heart attack, because then it can even cause blockage of blood flow to the heart itself, because the heart also supplies blood to itself. So the person can die from different modalities or different pathways. The second one is congenital long QT syndrome. This is a congenital problem, which means the person is born with it, and there is an excessive prolongation of the QT interval. QT interval is one of the intervals that are important when we read the ECG, which is the tracing of a person's heart. If it's excessively long, that QT interval, then the person becomes more at risk of developing arrhythmias, irregular heartbeats that could be dangerous, ventricular tachycardia, what we call torsades de pointes, and the person can even have ventricular fibrillation. All of these, which all of these can lead to death, sudden death. Arithmogenic right ventricular dysplasia, or you can otherwise call arithmogenic right ventricular cardiomyopathy, is another congenital problem where a person's heart muscles, usually in the right part of the heart, the right ventricle, get abnormally replaced by fibrofatty tissue, which means they get replaced by scar tissue and by fat tissue. And then what then happens is that the person's heart's ability to pump blood becomes impaired. The person can have shortage of blood supply out of the heart, as well as the person can go into abnormal heart rhythms, arrhythmias, which can lead to fatality, the person dying suddenly. So these are three common, not really common, but these are three important or prominent causes of sudden death in young persons, and we need to be aware of it. Now, you might be asking, doctor, what's the relevance of this information? Why are you telling us, this information? It's important that every young person or every individual actually has a clue about their cardiac health. How do you find this out? Two ways. One is called an ECG, and the second is called an echocardiogram. I know if someone who is well, if someone who is well comes to meet a doctor in a clinic, then obviously we'll begin to look at resources, availability of resources. Should we be doing these investigations or not? Are they clearly indicated in someone who is well? In such a situation, it might be difficult to justify. But if an individual is able to pay for these, if you're in a country where there is no NHS, there's no funded healthcare, and you have to pay out of pocket at the point of care, if you have the means, I would seriously advise you pay and get an ECG, which is a tracing of the heart, and then also get an echo, which is an ultrasound scan that shows exactly how well your heart muscles are pumping. The reason you need to get these is so you have peace of mind. At least you understand at a baseline level how well your heart functions. If any of your family members has ever died suddenly at a young age, this becomes even more important, that you need to know your baseline cardiac function. So I advise you pay for an ECG and an echocardiogram, so you know exactly where your heart, lies at a baseline. It's going to give you a high level of confidence when you're out there running, exercising. You're sure your heart is functioning well, and you're very unlikely to have a sudden cardiac death. I hope this information has been educative. I believe you've learned something today, and I believe you put into action this information by becoming more conscious of your health, especially your cardiac health. Thank you, guys.